societies can be judged by how they care for their elderly and their children. And I think we could add to that expectant moms, because that really is a measure of a community's, a society's commitment to its most fragile. We're invested in that future for that woman, for that child, for that family. Yesterday, today, tomorrow, and for life. I mean, what better illustration is there?
I was very lucky when they were doing some remodeling on the 5th floor. I knew we had some records up there, and I wanted to make sure that we were able to bring them down where they belonged here in the Family Care Center. So we have shelves of books going back to 1920s of all the deliveries that have ever been done. Even some of these were before the hospital on Olympian. It's still really fun to open up a book and go, there was my delivery.
We first came to town in 1961. Judy was 7 months pregnant. We were just coming out of the military. We had no health insurance. And so the clinic made a deal with us. Their total doctor's fee for the delivery of an offspring was $150.
I've had the privilege of not only delivering patients, but then delivering children for the women I've delivered.
I have 2 children. My daughter Tabitha, she's 9, and my son Theodore, he's 6. They were both born there, which is also where I was born.
So to me, that's always just kind of a perfect affirmation of the idea of the Beloit health system.
I mean, everybody you encounter, the whole experience was so wonderful.
A community-based health system, I feel, is more in touch with the patient population.
A place where that feeling of community and that feeling of belonging.
It's touching, seeing a parent bond for the child for the first time.
They helped me so much in terms of being confident about bringing a baby into the world.
Having a patient and her family ask you to participate in the delivery, that's truly an honor.
I'm very pleased that the hospital has chosen Family Care Center to be the next project.
Well, it means change, and I like change. It's always calling for something better.
The patients start here, they have their babies here, they get to know the hospital.
As a nurse, I think we need it just because of the supplies at hand and all those kind of things. The rooms, we need more room.
Let's start in the Family Care Center where we have the babies and make it spa-like and comfortable for them.
Provide a more comfortable, more personalized experience that will allow the mom and baby to feel at home.
I'm a little upset that this won't be done by the time I have my second child. So I won't personally get to experience this.
When you deliver a baby, to me the experience is much like a sunrise. And like any given sunrise, there's some commonality, but everyone is unique, and every birth is unique in that regard, each is like its own sunrise.
You don't know what they're going to look like. You don't know what they're going to sound like. It's just an amazing thing to hear their scream for that first time and to see them for the first time.
Every delivery is different, every family's different, and I treat it as if it is, just because that experience for that woman is unique.
I've been fortunate enough to actually deliver some of my friends' babies, so that's an amazing thing.
The nice thing about the Beloit health system is we really do focus on community, and that to me is really a critical element of what makes us special in an ever-evolving.
Just the experience was just amazing to me, and I wanted to be able to have that experience all the time. For me, I think it was just the home feeling that made me want to be here, wanted me to do this the rest of my life.
As we prepare to celebrate 50 years at the heart of the community, it's important that we look back and thank the individuals who helped build the health system for their legacy of excellence and commitment to provide the best care to our community. During those 50 years, we've had over 40,000 births in our Family Care Center. These new babies and their moms deserve that best care when they are born and throughout their lives as they become parents and grandparents themselves. We're very excited to work with our physicians and staff to design and upgrade the Family Care Center to give them the tools and the nurturing environment they need to fulfill this commitment to provide the best care. We are honored and humbled to carry on this tradition of excellence to provide the best care to our community. Our patients deserved it yesterday, and you and your families deserve it today, tomorrow, for life.
Yesterday,
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 Today,
Today,
Tomorrow,
for life.